name is Keely Malchow. I'm a student athletic trainer at the University of Northern Iowa. I heard you've been having some knee troubles during the leg, so I'm going to touch your knee.
Yeah.
Perfect. Yeah. So to start off, I'm going to ask a couple of history questions just to get an idea. So where exactly is your pain? If you could like point with just one finger.
I'd say more right here,
Right
above
there?
my knee.
Okay. All right. Do you know what activity you were doing to start this, or?
I notice it kind of really hurts whenever I'm like jumping or squatting, like
Okay.
bending down.
All right.
Anything.
Did you hear anything when you got injured?
No, it just kind of started hurting more over time.
Okay. So when you say it started over time, it's been a gradual. Like,
Yeah,
onset?
yep. It's been bugging me more lately
Okay.
than it has before.
Rate your pain on a pain scale of 1 to 10.
Probably like when I'm playing, it's probably like a 7 out of 10, and then just like right after practice, it still kind of hurts a little bit, but not as bad.
Okay. So the pain that you're feeling, that's 7. Can you describe what type of pain you're feeling?
It's kind of like a deep, kind of like achy pain, like just right there. Kind of like, I don't know if I would say rubbing or, I don't know, it just really hurts.
Okay. Have you done anything to alleviate the pain at all?
Just some ibuprofen and ice after practices.
Does the pain increase with any particular movements?
Just when I'm like jumping and squatting down, running a little bit.
As a child, did you ever sit with like your legs out, like in a W position?
Yeah, I guess I actually kind of did.
Do you know how often you would do that?
Kind of like all the time.
Okay.
I guess.
Okay, well, very good.
Now we'll begin the observation section of our evaluation. You see here, Vitellas, they look fine as sitting down, but as she was walking in, their alignment had a slight frog-eyed appearance. As you can see, there's no obvious swelling. Up here maybe a little bit, nothing on this side, so we have to compare bilaterally. No obvious ecchymosis or discoloration. There's no abnormal disformalities, nothing sticking out of her knees, so that's all good. At this point of the section, we're all right.
Now we're going to analyze gait. There are 2 phases of gait. There is the stance phase and the swing phase, and we're now going to break down the stance phase. In the first step of stance phase, we are now going through initial contact, which is heel strike, toe off, and this is the lateral view. This is the posterior view. And then this is the anterior view. Step 2 of the stance phase is loading response, where we have flat foot and toe off. This is the lateral view. Posterior view. Anterior view. This is step 3 of stance phase. Mid stance, where the foot is flat on the ground and the other foot is up in the air. This is the lateral view. Posterior view. Anterior view. Step 4 of stance phase is the terminal stance, where the back foot is planted on the ground and the other foot is up in the air. Lateral view. Posterior view. Anterior view. The final step of stance phase is the pre-swing, where the back foot is toeing off and the front foot is up in the air. This is the lateral view. Posterior view. Anterior view. The last step of swing phase is the terminal swing, where where the back foot is toeing off and the front foot is slightly up in the air. This is the lateral view. Posterior view. Anterior view.
Okay, now for bony structure palpation, we'll start at the tibia and go from away from injured site up towards it. Any pain throughout that?
Nope.
Okay, and tibial tuberosity, any pain there? Pain in the patella?
Kind of at the top.
Okay. Lateral condyle. Anything in there? Medial condyle. Joint line pain, anything on the lateral side here? Medium side? Okay. And then we'll go fibular head. Any pain there? Okay.
Tight.
Anything about along here?
Yeah.
Down here.
Not so much.
Shoe palpations? Are you having pain here?
No. Kind of above my knee, but
Any pain along here?
yeah, kind of tender. Tight.
Anything along here? About along here? Here?
Yeah.
Down here.
Not so much. Up next, we have range of motion. So, for the range of motion, we are going to test flexion and extension. So, for starters, we'll start with extension. So, I'll have you lay back, and I'm going to line out my goni with the shaft of the femur, right there. And this is going down the shaft of the tibia. All right, and it looks like we're starting at about 5 degrees. All right, now I'm gonna have you push or try and straighten your leg out as much as possible. All right. And hold that there. Okay, you're good. And then it looks like the goni moved to about 3 degrees, so that'll be 8 degrees of extension. Okay, so for video purposes, I'm going to have her spin around just so that we can see the bilateral testing of extension again. So I will do the same thing, line it up with the femoral shaft and the tibial shaft. And we're sitting at about 5 degrees again. And now I'm going to have you extend your leg as much as possible. All right, you can relax. And then that went to 5 degrees, so that one had about 10 degrees of extension, which is pretty normal. And then I will have her test for range of motion for flexion, so I'm going to have you flip over. All right, now for flexion, I'm going to have the stable arm on the femoral shaft again, and this on the tibial shaft. So we're starting at about 5 degrees. Then I'll have you bring your heel to your butt. All right, so that went to 115 degrees, so that's about 110 degrees of flexion. And then I'll have you flip around again just for video purposes to show the bilateral testing. So we'll be on the femoral shaft again to the tibial shaft. And we're at about 5 degrees again, so I'm going to have you bring your heel to your butt. Now it looks like about 115 degrees of flexion, so that calculates out to 110 degrees flexion, just like the other one. Okay, now we'll test extension again of the knee. So I'm going to put my hand underneath to just feel to see the extension, and then I'll push down, and there's some extension there. And then I test bilaterally. All right, and then there's some extension there as well, and it feels about the same, so that's good. And then I'll have you flip over for flexion. All right, and I'm just going to pull her down like this. All right, there's some resistance there. And then with this one, feels about the same. How did both of those feel?
Good.
Did one hurt more than the other?
My left one hurt more than the right one.
Okay, during flexion?
Mm-hmm.
Yeah. Okay, all right.
Alright, so we're going to do some manual muscle tests here to see if you have any muscle weakness at all. So we will start off with popliteus. You're in the correct position for it. I just need you to turn your feet in and out for me. Any pain there? Okay. And then we're going to move to the quadriceps. So I'm going to stabilize here. Grab right here. I need you to kick your leg out. Is that painful? Yeah. Okay, I'm going to do the same one because we're going to test bilaterally. Is that as painful? Okay. We will move to sartorius. So I need you to lay back flat and scoop a little bit up this way. Okay, so have your leg in a figure 4 position, and I'm going to try to break this position. You try to stay just the way you are. Okay. Is that painful at all? No. No? We'll do the same one bilaterally. Okay. Oh, strong. Okay, so we'll do the last two. We're going to start with semitendinosus, semimembranosus. Foot turns on the inside. I'm going to try to push your leg down. You stay just in the position that you are. Painful at all? No. Okay. Now biceps femoris. So your foot sticks out. Same exact thing. Is that painful at all? No. Okay.
Okay, and now we will test just some normal special tests. Since we're dealing with the knee, I'm going to try and rule out any ACL tears at all. So we'll start with the anterior drawer. So if I can have you flex your knee up like this, and is it okay if I sit on your foot? All right. So I'm going to sit on his foot to stabilize it, and I'm going to grab right down here and just kind of pull forward. And I'm looking for the tibial tuberosity to rise a little bit, and as you can see, there's no movement there, so that's a negative test for ACL. And then we'll do one more. We'll do the Lockman's test. So I'll go like this. I'm going to put my leg underneath yours, and then I'm just lifting like this, looking for that rising of the tibial tuberosity, which again there is none, so we'll rule out ACL tear. So next we'll move on to Ober's test, and this is testing for IT band tightness. So I'll have you flip around real quick, that way we test your leg. And we'll have you like this, and I'm going to take your leg and go back and let it just hang off the table. Alright, and as you can see there's a little IT band tightness. Usually it would drop past the table, but here we have some tightness, so that's a positive test. And I'll have you lay back on your back. Alright. Now this next one is the apprehension test, and this is just looking for any laxity in the patella. So I'm just going to slide your kneecap over a little bit, and it does slide laterally a little bit. Is there any pain with that at all?
Not a whole lot, just where your hand is, the upper hand, just by pressing down there.
Yeah, and that's just that dull, achy pain again?
Yep.
Okay. So that shows we have some laxity in his kneecaps. All right, now next we'll do McMurray's test, which is just kind of a MCL, LCL, and meniscal tear test, just to, again, make sure everything in the knee is okay. So we'll start up like this. And I'll put my hands at the joint line. And we'll go up like this. Do you feel any pain out
Nope.
here? Going up, or any pain in like that?
Nope.
Alright. Well, that's good then. A negative test for that. And then lastly, we have the stutter test. I'll have you come and sit down here at the end of the table. And this is a test to test for any plica at all. So what I'm going to have you do is just lift your leg up to the sky. Alright, and you're looking for any crunchies or anything, which he does have a little bit of that. And when he does that, I can kind of feel his patella pulling to the lateral side a little bit, so we'll check bilaterally for that. And with this one, there's also a little crunch for the plica, but I don't feel it pulling quite as much to the outside like this one, so that's a positive test for plica.
The conclusion of evaluation has come to that our patient has tight IT bands. This could be due to tight hamstrings, weak vastus medialis obliques, overstrong vastus lateralis obliques, weak external rotators, and as a child they could have sit in the W or M position watching TV and other activities. Following our evaluation, our short-term plan is to get the patient pain-free. We want the irritation to go down. They will be able to continue practicing and playing, but we'll give them a J-brace to help pull the patella medially so the tracting of the patella will glide as a normal patella would. We will continue to tape, kinesiotape if needed. We will play around with different other techniques in order to have this patient play as pain-free as possible. Our long-term goals will be to get this patient with full range of motion with pain-free. If the previous assessment and previous evaluation does not get the patient back to full health, we will refer them as needed.